Now, I'm sure you remember the devastating story of Dr. Stephen Wright, the 32-year-old NHS psychologist who tragically died from a blood clot on the brain just 10 days after receiving his first dose of the AstraZeneca vaccine back in January 2021. Stephen's widow and mother of his two young children, great friend of the show, Charlotte Wright, has been fiercely campaigning to have the vaccine's role in his sudden death acknowledged ever since. And today, finally, this moving milestone was reached, with a coroner's inquest ruling that Stephen died from, quote, unintended complications of the vaccine. His death certificate had officially only listed natural causes before today. Charlotte's very important, very significant legal victory comes as vaccine victim and BBC presenter Lisa Shaw's husband revealed that her death certificate did list the AstraZeneca vaccine as her cause of death, and he says he is desperate for the country to sit up and take notice of her heartbreaking and far from unique story. Shockingly, the legal acknowledgement Charlotte received at Southwark Crown Court today has taken over 2 years to achieve, and having still received no apology from AstraZeneca, Charlotte remains far from happy with them or the British government. She is now pursuing legal action against the pharmaceutical company along with dozens of other vaccine victims. I'm honoured to say Charlotte is back in the studio with me again today. Charlotte, I can only imagine how emotional today has been for you, but well done you, because you fought for this and it wasn't easy.
Yeah, we all did. Yeah.
How do you feel?
Exhausted. But it does provide relief. I think for fighting for so long, and now to have that proof in black and white is comforting, and we do feel that we are finally acknowledged.
Because it was outrageous it wasn't listed on the death certificate,
Yeah.
wasn't it? Mm. And do you think they just wanted you to go away?
I mean, at the time, I just felt silenced. It was the actual hospital that called me to tell me that it was the vaccine that caused his death, and that was about 2 months after he died. So it's just been so long to try and get anyone to listen. I mean, it was GB News yourselves that was the first to kind of even really hear us and let us speak.
And, of course, there was pushback. There was pushback against the channel. There was pushback against you. We were collectively described as conspiracy theorists, as anti-vaxxers.
Yep.
Do you feel angry or do you feel glad that people are maybe starting to educate themselves now?
I mean, for it to be spoken about now, I'm definitely glad.
Because the BBC covered your story today. And they've ignored you for years.
Yeah, I mean, even when they came to my house and filmed me, I still felt like they purposefully put a pro-vaccine spin on it and sort of twisted my words a little bit as well. So for them to cover it nationally now was shocking, really. I wasn't expecting it. No,
and it is good, but I think a lot of people should be apologising for the way they have treated people like you over the past couple of years. How do you think Stephen would feel today? Proud?
I think to see myself and both his parents standing there in camaraderie, I can't say the word.
Camaraderie, yeah.
That's it. Just
He's got
in
an
strength
absolutely
together.
wonderful family.
They're so supportive, and I really couldn't have done everything without them, and my family as well. Just having two young children is hard without that support, so I'm very grateful to them.
But your fight goes on, and it's important. So can we talk about the next steps, Charlotte? Because, of course, this legal action is building, but one of the things that a lot of people don't know, and it feels particularly outrageous, is that they have an indemnity. You know, AstraZeneca have an indemnity, so anything that you potentially win, am I right in saying it will be paid for by the government?
It will be, yeah. So to push the vaccine out so quickly, the government said that they had to indemnify, therefore knowing that there will be adverse reactions. So I think one of our kind of things that we've been trying to say is that if you knew that before you rolled it out, then where was the support for the people that you knew would be adversely affected by it, you know, so it should have been in place before.
And there's a whole number of you who are taking this legal action together. What can you tell me about where it's at?
Just that Peter Todd and Sarah Moore both together, they have sent the letter of intent to AstraZeneca and the government, and we are awaiting a response from them any day now. So,
do you think there was a risk with this, with the government? With the way the government acted, you know, should they never have agreed to this indemnity?
I think that if you are going to roll out and then to a point mandate something, then there should have been a lot more care and consideration for those who you knew would have been affected by such a decision.
Because you lost your wonderful husband. He was young, he was vibrant, he was healthy, he was a doctor.
Yeah.
And your children have lost their dad.
Yeah.
So I think it's really important we just think of the human toll of this decision today.
Yeah.
Well, look, we've been thinking of you.
Thank you.
So happy for you.
Thank you.
But of course, the fight goes on.
It does.
And you know we're with you here at
so
TV
much.
News. Thank you so much. Charlotte Wright.
Thanks, Dan.
Now, when we approached them for comment earlier today, AstraZeneca said, "We are very saddened by Stephen Wright's death and extend our deepest sympathies to his family for their loss. Patient safety is our highest priority and regulatory authorities have clear and stringent standards to ensure the safety use of all medicines, including vaccines. From the body of evidence in clinical trials and real-world data, Vaxzevria has continuously been shown to have an acceptable safety profile, and regulators around the world consistently state that the benefits of vaccination outweigh the risks of extremely rare potential side effects." Meanwhile, the Department for Health and Social Care said more than 144 million COVID vaccines have been given in England, which has helped the country to live with COVID and saved thousands of lives. All vaccines being used in the UK have undergone robust clinical trials and have met with the Medicines and Healthcare Products Regulatory Agency's strict standards of safety, effectiveness and quality.